All right, last video we're going to do on wound care today. This video we're going to talk about the use of therapeutic modalities in conjunction with doing wound care. Specifically, we're going to talk about different forms of E-Stim as well as using ultrasound over a wound to heal the wound, right? So there are a couple different parameters, and a lot of studies show that wound care with E-Stim itself has been beneficial. The downside to wound care with E-Stim is typically if you're doing E-Stim with wound care, it's going to take long periods of time with a small current because obviously you don't want to send a lot of electricity into that area and polarize that wound. The most common wound care we do with, or the most common E-Stim we do with wound care is high volt. So with a high volt wound care service, what we are going to do is it's going to be a monopolar service, meaning that there's going to be one active electrode and one dispersive electrode. The dispersive electrode is going to be placed somewhere on a large open area of skin away from the wound area. The active electrode itself is going to go right over the wound. And the way we're going to do that is, first of all, we're going to get some standard everyday ordinary gauze, and we're going to fill it with hydrogel. So it needs to be nice and moist. Again, that petroleum jelly substance is going to be useful in getting the gauze nice and moist for this filling. Then we're going to take the gauze and we're going to fully and utterly pack the gauze into the wound bed. So that wound bed is fully packed and ready for the active electrode. Once we have that done, we're going to take our active electrode, and there's going to be a special electrode we use that lays directly over that impregnated gauze now coated with hydrogel. You're going to take the dispersive electrode, and the dispersive electrode is usually going to be the larger of the two electrodes. In this case, I'm just using standard electrodes. And the dispersive electrode you're going to place somewhere opposite the wound in an area either distal or proximal, but away from the wound in a large open area of skin. Then you're going to set your high volt parameters up, and the high volt parameters will vary in that if you're working with a PT that does high volt on wounds, please consult them as to what their standards are for it. But there has been some positive results with monopolar electrode use during high volt current in treatments as little as an hour a day. So you want to, it depends upon what your PT is going to order, but this is going to be placed on them. Are they going to feel it? They might feel a little bit of tingling around the edges, right? But for the most part, again, that area that's inside the wound itself is insensate. It has no feeling. So pushing the electricity in there doesn't harm anything, right? The goal is sending the electricity into the wound to stimulate all that healthy tissue in there, to cause it to activate a little bit, to excite those mitochondria, and allow increased blood flow, increased overall function in that wound bed so that it allows things to heal, right? Electricity has also been shown to have a little bit of an antimicrobial or antibacterial effect as well, but that's kind of minorly documented, not majorly documented. It's just using the E-Stim in order to treat the wound itself. But that's if we were going to use high volt. If we're going to use a standard biphasic current, right? With biphasic current now, we're going to have two active electrodes. A standard biphasic current, so the benefit to using standard biphasic versus using high volt is, with high volt, we've got to redress the wound and open the wound up. With standard biphasic, we're going to place the pads on the peri-wound area, so we don't actually have to access the wound itself. So the wound can be dressed, and we're going to place it on the peri-wound area. So in that case, we're going to place the pads on either side, and what this can help do is it can help approximate those wound edges faster, help those wounds to heal, right? The downside to this is it's going to require more current because you do want to get a microcontraction in the area, so you want to get a little bit of that fasciculation, so a little bit of that quivering like we would get with a chronic TENS or a chronic IFC. So it's going to require a little bit more. It's going to be a little bit more uncomfortable, and a lot of times this is going to require a lot longer treatment time than your high volt. So all of that comes into play when you're working with this E-Stim, but either high volt or biphasic current can be used in conjunction with your traditional wound care again. We're not going to use it in solo, right? Just like we're not going to do wound care by itself. If we only dress the wound and change the wound, they're not going to get better. They've got to continually maintain their nutrition and also got to get up and moving, or they're not going to improve. This, in conjunction with our traditional wound care, in conjunction with our traditional therapy, will allow that wound bed to heal a lot faster. And that's what we want. The E-Stim is going to help heal that wound faster. E-Stim can also be used in conjunction with wound therapy and moving edema out of the area, right? A lot of lymphedema specialists use E-Stim to help push that fluid, right? They'll put the pad that correlates to the charge of the edema at the wound site and a pad more proximal that's opposite charge. So the pad that's the same forces away, right? The sames repel, and the opposites attract, so it's going to draw it closer to those lymph nodes so that it actually can get drained out. Any of that can be used in conjunction with wound therapy, right? So that's if we're going to use E-Stim with wound therapy. If we're going to do ultrasound in wound therapy, we can do ultrasound a couple different ways. If we're just worried about doing ultrasound on the peri-wound area, we can do ultrasound on the peri-wound area, right? And that'll provide some healing and some relief to that wound. Or we can also do ultrasound, and we're going to use this small wound right here. We can also do ultrasound to the wound area itself. And we're going to use, okay, so we talked about this in class before. Continuous is for heating effect. Pulsed is for healing. Typically, we're going to do a 20% pulse when we're doing wound care. And with that 20% pulse, we usually do about 1 watt per centimeter squared, somewhere in that range, depending upon what we're doing. So in this case here, I have a small stage 1 pressure injury. What I'm going to do is I need to get very specific ultrasound gel. So it's typically going to be ultrasound gel for wound care, or I can use hydrogel, it doesn't matter. And I am going to fill in the wound. Right? I want that wound nice and full. Again, why do I want that nice and full? So it's going to conduct the electricity. Then I'm going to take a clear film dressing. Right? So let me get this film dressing opened up here. We're going to take that film dressing, and guess what we're going to do? We're going to lay that right over that wound. Make it nice and snug. So now we got it over the wound. We're also then going to have to, just like we did bladder, we're going to have to put some ultrasound gel on top of the wound, right? So once we've got all that kind of set up, we've got the ultrasound gel under it, we've got the ultrasound gel on top of it, and now we're ready to do some ultrasound, right? We want that tegaderm, or that clear dressing, down as adhered as much as possible. We're going to get our ultrasound head, right? We're going to set our machine up. We're going to set our machine up for pulsed 20%. We're going to get our head on. We're going to start our head moving, right? And then we're going to start adjusting our ultrasound, right? So our head's going to move at our 2 to 3 centimeters, or 3 to 5 centimeters per second, right? And get it moving, moving, moving. And then we're going to keep moving it as we turn our intensity up to 1 megahertz, or 1 watt per centimeter squared. Ultrasound has shown great results in actually allowing wounds to heal again. Again, it helps with tendons and bones. We know that it helps with that, so we know that it should help with healing wounds as well. It's going to work at the cellular level again, so they may not feel anything, but the ultrasound will help speed along the recovery of that wound. That's it for basic wound care for the modalities. If there are any questions on this, please see me.